Are you taking a medication every single day that could be silently damaging your erections, draining your desire, and slowly disconnecting you from your sexual confidence without you ever realizing it? For millions of men, erectile dysfunction doesn't start with age, stress, or relationship problems. It starts with a prescription. A pill that was meant to help you live longer, feel calmer, or manage pain may be quietly interfering with the most sensitive systems in your body. Most men never make the connection. They wake up one day and realize their erections aren't as firm as they used to be. Their desire feels muted, intimacy feels harder, less spontaneous, less reliable. And instead of questioning the medication they take every morning, they assume the problem is themselves. They assume it's aging, they assume it's irreversible. I'm Dr. Selena Clarke, a urologist who has spent more than 10 years helping men over 50 restore sexual function without sacrificing their overall health. And what I'm about to share is not speculation or opinion. It's based on large-scale clinical research, pharmacology, and real patient outcomes. Studies consistently show that approximately 25% of all erectile dysfunction cases are directly caused by medications. That means 1 out of every 4 men with erection problems may be experiencing a drug side effect, not a permanent condition. Global pharmacovigilance data collected from millions of adverse event reports, including analysis of the World Health Organization's International Drug Safety Database, repeatedly highlights the same medications showing up alongside reports of erectile dysfunction, reduced libido, delayed ejaculation, genital numbness, and loss of sexual satisfaction. Yet most men are never warned. Here's what makes this problem especially cruel. When doctors prescribe medication, the focus is usually on the primary goal: lower blood pressure, stabilize mood, reduce pain, control symptoms. Sexual side effects are often treated as secondary or ignored altogether. In some cases, they are deliberately not mentioned. Research has demonstrated a phenomenon where patients who are warned about possible sexual side effects report them more often than patients who are not warned. In one landmark study, nearly 1/3 of men who were informed about erectile risks reported problems compared to only a small fraction of men who were not told. This has created a deeply flawed and ethically questionable pattern. Some clinicians believe that if they don't mention sexual side effects, patients are less likely to experience them. But what actually happens is far worse. Men develop erectile dysfunction, don't understand why, and suffer in silence. They blame themselves, they assume nothing can be done. At the same time, many men feel uncomfortable bringing sexual concerns to their doctor. They worry about embarrassment. They worry they won't be taken seriously. Studies show that sexual dysfunction is one of the most underreported medical side effects. Men endure frustration, distance in relationships, and loss of confidence for years, even though simple medication adjustments could completely resolve the issue. I once treated a 62-year-old man who had been taking an antidepressant for several years. Over time, his erections faded almost entirely. His libido disappeared. Intimacy became mechanical and eventually stopped. He never once connected this decline to his medication because no one had warned him. When we reviewed his prescriptions and worked with his psychiatrist to switch him to a different antidepressant, his erections returned within weeks. His reaction was anger mixed with relief. He told me he had wasted years believing something was permanently broken. Understanding which medications cause these problems and how they interfere with sexual biology is the first step toward fixing them. One of the most common and damaging categories is antidepressants, especially selective serotonin reuptake inhibitors, commonly known as SSRIs. SSRIs are among the most widely prescribed medications in the world. They include drugs like fluoxetine, sertraline, paroxetine, citalopram, escitalopram, and fluvoxamine. These medications save lives. They help manage depression, anxiety, and obsessive thoughts. But they also have a well-documented and often severe impact on sexual function. Clinical studies show that between 30% and more than 50% of people taking SSRIs experience sexual dysfunction. In some controlled trials, reported rates climb above 70%. Certain SSRIs are consistently associated with higher risk. Men may experience difficulty achieving erections, inability to maintain firmness, loss of desire, delayed ejaculation, or orgasms that feel emotionally empty and physically muted. Some men describe feeling disconnected from sexual pleasure altogether. The biological mechanisms behind this are complex but very real. SSRIs work by increasing serotonin levels in the brain. While serotonin helps stabilize mood, it also suppresses sexual response. Elevated serotonin activity directly inhibits neural pathways involved in erection and arousal. Specific serotonin receptors interfere with erectile signaling and delay ejaculation. At the same time, increased serotonin suppresses dopamine, the neurotransmitter responsible for motivation, pleasure, and sexual drive. When dopamine signaling drops, libido often disappears. SSRIs also interfere with the autonomic nervous system, the network that controls involuntary processes like erections. They affect receptors involved in both sympathetic and parasympathetic activity, disrupting the precise coordination required for penile blood flow. Additionally, these medications reduce nitric oxide availability. Nitric oxide is the chemical signal that tells penile blood vessels to relax and fill with blood. Without enough nitric oxide, erections weaken or fail entirely. Some SSRIs also raise prolactin levels. Elevated prolactin suppresses testosterone production and directly reduces sexual desire and erectile quality. Over time, this hormonal disruption compounds the problem, especially in men whose testosterone levels are already declining with age. For most men, these sexual side effects are reversible. But for a small percentage, sexual dysfunction persists even after stopping the medication, a condition sometimes referred to as post-SSRI sexual dysfunction. While rare, it highlights why informed consent and careful medication selection matter. The solution is not to abruptly stop antidepressants. Sudden discontinuation can cause withdrawal symptoms, mood instability, and serious psychological distress. The solution is awareness and collaboration. Many men do well on antidepressants that act on dopamine and norepinephrine rather than serotonin. Others improve by adjusting dosage, changing timing, or adding medications that counteract sexual side effects while preserving mood stability. In some cases, erection support medications restore function while the antidepressant continues. I've seen men regain full sexual function without sacrificing mental health simply by switching medications under medical supervision. One man told me that learning his problem was medication-related felt like having a weight lifted off his chest. He wasn't broken. He was reacting exactly as his biology predicted. Medication-induced erectile dysfunction is not a personal failure. It is a physiological response to chemical interference in finely tuned systems involving neurotransmitters, hormones, blood flow, and nerve signaling. And antidepressants are only the first category. As we continue, we'll uncover other extremely common medications that quietly interfere with erections and desire, often for years, and what practical steps you can take to protect both your health and your sex life without putting yourself at risk. After antidepressants, the next group of medications that quietly damages erections and sexual desire is one that millions of men take every single day to stay alive and avoid heart attacks and strokes. Blood pressure medications. High blood pressure itself can harm erections by damaging blood vessels, but certain blood pressure drugs make the situation much worse. Many men are shocked to learn that the very medication meant to protect their heart may be interfering with blood flow and nerve signaling to the penis. Among all blood pressure treatments, two categories stand out as the most problematic for sexual function: thiazide diuretics and beta blockers. Thiazide diuretics include drugs commonly prescribed as first-line therapy for hypertension. Beta blockers are often prescribed after heart attacks, for arrhythmias, or for long-term cardiovascular protection. Both are effective, both save lives, and both are well documented to cause erectile dysfunction in a significant percentage of men. Thiazide diuretics work by increasing the excretion of salt and water through the kidneys. This lowers blood volume and reduces blood pressure. From a cardiovascular standpoint, this is beneficial. From a sexual standpoint, it can be disastrous. Erections depend on strong, sustained blood flow into the penile arteries. When overall blood volume drops, penile blood filling becomes weaker and less reliable. Even if desire is present, the physical response may not follow. There is also a hormonal component that most men and many doctors are unaware of. Thiazide diuretics increase the loss of zinc in urine. Zinc is essential for testosterone production and normal prostate function. Chronic zinc depletion can suppress testosterone synthesis over time, leading to reduced libido, weaker erections, fatigue, and loss of sexual confidence. This effect builds slowly, which is why many men never realize what is happening. Beta blockers affect erections in a different way. These drugs blunt the sympathetic nervous system, the part of the nervous system involved in initiating and sustaining erections. By blocking beta-adrenergic receptors, they interfere with the cascade of signals that allow penile smooth muscle to relax and arteries to dilate. In simple terms, the brain sends the signal, but the message never fully reaches the penis. Beta blockers also commonly cause fatigue and reduced exercise tolerance. When energy drops, sexual interest often follows. Men taking these medications frequently report difficulty getting erections, trouble maintaining firmness, reduced sexual desire, and a general sense of physical sluggishness that spills into intimacy. Some experience changes in ejaculation, including reduced volume or altered sensation. The most damaging part is that many men assume these problems are caused by high blood pressure itself, not realizing that alternative treatments could control blood pressure just as effectively without harming sexual function. The solution, again, is not stopping medication on your own. Uncontrolled blood pressure is dangerous and can permanently damage the arteries supplying the penis. The solution is choice. There are multiple classes of blood pressure medications that achieve excellent control with far fewer sexual side effects. ACE inhibitors and angiotensin receptor blockers work through hormonal pathways that do not reduce blood volume or disrupt sexual nerve signaling. Calcium channel blockers relax blood vessels without interfering with libido or erectile mechanisms in most men. For many patients, switching within blood pressure drug classes leads to dramatic improvement in erections within weeks. I've treated men who spent years believing their erections were gone for good, only to see them return after a simple medication change. One man had been on a diuretic for nearly a decade. After switching to a different blood pressure medication under his cardiologist's guidance, his erections improved steadily over a month. His blood pressure stayed perfectly controlled. The only thing he lost was unnecessary sexual dysfunction. The third major category of medications that damages sexual function works through a completely different pathway, one that strikes at the core of male hormonal health. Opioid pain medications. These drugs include commonly prescribed treatments for chronic pain, such as oxycodone, hydrocodone, morphine, fentanyl, codeine, and tramadol. In addition, medications often used for nerve pain, such as gabapentin and pregabalin, are frequently associated with erectile dysfunction and reduced libido. Opioids suppress sexual function by disrupting the hormonal control center that regulates testosterone production. This system, known as the hypothalamic pituitary gonadal axis, is responsible for signaling the testes to produce testosterone. Opioids bind to receptors in the brain that shut down this signaling cascade. As a result, levels of gonadotropin-releasing hormone fall, luteinizing hormone decreases, and the testes stop producing adequate testosterone. This condition is known as opioid-induced hypogonadism. It is extremely common among men on long-term opioid therapy. Studies show that testosterone levels in these men often fall well below the normal range, sometimes dropping by 50% or more. Low testosterone directly causes loss of libido, erectile dysfunction, reduced muscle mass, increased body fat, fatigue, depression, and mental fog. Even young men on chronic opioids can develop the hormonal profile of someone decades older. Beyond hormones, opioids also cause sedation and dull emotional responsiveness. Sexual desire depends on mental engagement, motivation, and anticipation. Opioids flatten these responses, making intimacy feel distant or unimportant. Many men describe feeling disconnected from their own bodies while taking these medications. The tragedy is that long-term opioid use often does not improve quality of life. Modern pain medicine recognizes that chronic opioid therapy frequently creates more problems than it solves. Alternative pain management strategies exist and are often more effective over time. These include non-opioid medications, targeted physical therapy, interventional pain procedures, and behavioral approaches that retrain pain pathways. When opioids can be reduced or eliminated, testosterone levels often recover, and sexual function improves dramatically. I once worked with a man who had been on opioid pain medication for years following a back injury. His testosterone was severely suppressed. He had no sexual desire and could not achieve erections. With the help of a pain specialist, he gradually transitioned to non-opioid treatments. Over several months, his testosterone levels rose, his energy returned, and his sexual function came back. He told me that regaining his sex life felt like reclaiming a part of himself he thought was lost forever. Blood pressure medications and opioid painkillers are two of the most powerful but overlooked causes of medication-induced erectile dysfunction. They act through different biological systems, but the outcome is the same: disrupted blood flow, altered nerve signaling, and suppressed hormones. And yet, in many cases, the damage is reversible. As we move forward, we'll look at medications that many men don't even think of as dangerous because they're available without prescription or are taken for cosmetic reasons rather than medical necessity. These drugs often fly completely under the radar, yet they can have profound effects on sexual function when used chronically. There are two more categories of medications that quietly interfere with erections and desire, and what makes them especially dangerous is how harmless they appear on the surface. One is commonly bought without a prescription. The other is often taken for cosmetic or lifestyle reasons rather than medical necessity. Because of that, men rarely suspect them, even when sexual problems begin shortly after starting them. The fourth category is antihistamines, including many over-the-counter allergy and sleep medications. These drugs are used by millions of men every day for allergies, colds, itching, heartburn, and even insomnia. Because they are so widely available, they are often assumed to be safe and side effect-free. In reality, chronic use can significantly interfere with sexual function. Older first-generation antihistamines are particularly problematic. These medications easily cross into the brain and cause sedation. That sedating effect doesn't just make you drowsy. It suppresses central nervous system activity that is essential for sexual interest and arousal. When the brain is slowed down, sexual desire is often one of the first things to disappear. Antihistamines also block acetylcholine, a neurotransmitter that plays a key role in the parasympathetic nervous system. This system is responsible for initiating erections by allowing blood vessels in the penis to relax and fill. When acetylcholine signaling is blocked, erections become weaker, slower, or unreliable. Many men notice reduced morning erections and difficulty responding to sexual stimulation without understanding why. One specific medication in this category deserves special attention because of its direct hormonal effects. Certain heartburn medications act as antihistamines and also block androgen receptors. This means testosterone may be present in the body, but it cannot properly bind to its receptors and exert its effects. Over time, this can lead to reduced libido, erectile dysfunction, and even breast tissue development in men. These effects can occur gradually, making them easy to miss until sexual function is significantly impaired. The good news is that safer alternatives exist. Newer generation allergy medications are far less sedating and have minimal effects on sexual signaling. Local treatments such as nasal sprays work directly where they are needed without affecting the rest of the body. For heartburn, alternative medications control acid production without interfering with hormones. Many men notice improvement in energy, desire, and erections within weeks of switching. I once treated a man who had been using an over-the-counter sleep aid and allergy medication daily for years. He assumed his sexual decline was simply part of getting older. When we removed those medications and replaced them with alternatives, his morning erections returned within 2 weeks. Nothing else changed. The medications alone had been suppressing his sexual system. The fifth and final category includes medications used for hair loss and prostate enlargement. These drugs work by blocking the conversion of testosterone into dihydrotestosterone, a more potent androgen. While this can slow hair loss or shrink the prostate, it also alters the hormonal environment that supports male sexual function. Dihydrotestosterone plays a powerful role in libido, erectile quality, and sexual confidence. Reducing it by large amounts may help hair follicles, but it can blunt desire, reduce erection strength, and decrease ejaculate volume. Some men also experience emotional changes, including anxiety and low mood, which further suppress sexual interest. These medications also affect neurosteroids in the brain, compounds that influence mood, motivation, and sexual response. Disrupting neurosteroid balance may explain why some men experience persistent sexual symptoms even after stopping the drug. While this outcome is uncommon, it has been reported often enough to be taken seriously. Men taking these medications must ask an honest question. Is the benefit worth the risk? For some men with severe urinary symptoms, the answer may be yes. For others taking them primarily for cosmetic reasons, the trade-off may not be acceptable. Alternatives exist that do not interfere with hormones, including topical treatments and mechanical procedures that address prostate symptoms without altering testosterone pathways. I've worked with men who chose to stop these medications after years of declining sexual function. Many saw partial or full recovery of libido and erections within months. One man told me he would rather accept thinning hair than lose intimacy with his partner. That decision restored not just his sexual health, but his sense of vitality. At this point, the pattern should be clear. Medication-induced erectile dysfunction is not rare, it is not imaginary, and it is not something you have to silently tolerate. These drugs affect sexual function through real biological mechanisms involving blood flow, nerve signaling, neurotransmitters, and hormones. When those systems are disrupted, erections suffer. So what should you do if you suspect your medications are affecting your sex life? The first step is awareness. Write down every medication you take, including prescriptions, over-the-counter drugs, and supplements. Note when you started each one and when your sexual symptoms began. Patterns often become obvious once you see everything laid out. The next step is a focused conversation with your doctor. Do not bring this up casually at the end of an appointment. Make it the reason for the visit. Be direct. Say that you are experiencing erectile dysfunction or reduced libido and want to review your medications for possible contributors. A good physician will take this seriously. Never stop medications on your own. Many drugs require careful tapering. Abrupt discontinuation can be dangerous. Instead, ask about alternatives, dose adjustments, or timing changes. In many cases, switching to a different drug within the same category preserves the medical benefit while reducing sexual side effects. If a medication cannot be changed, ask about strategies to counteract its effects. There are treatments that restore erectile function even when the underlying medication must continue. Hormone levels can be monitored and addressed when appropriate. The key is systematic problem solving rather than resignation. I once treated a man who was taking multiple medications that all contributed to sexual dysfunction. Over several visits, we adjusted his treatment plan step by step. Nothing dramatic, just thoughtful changes. Within 3 months, his erections and libido improved dramatically. He told me the process required patience, but the result was life-changing. Here's the message I want you to remember. Around 1 in 4 cases of erectile dysfunction is caused by medication. That means the problem is often not permanent, not psychological, and not your fault. It is a side effect. And side effects can often be fixed. You should never have to choose between your health and your sex life. With informed decisions, open communication, and proper medical guidance, you can protect both. Sexual health is not a luxury. It is a fundamental part of quality of life, emotional connection, and overall well-being. Advocate for yourself, ask questions, demand explanations. If your concerns are dismissed, seek another opinion. You deserve care that treats you as a whole person, not just a set of lab numbers or diagnoses. Medication-induced erectile dysfunction is real. It is common, and in many cases, it is reversible. Take the first step by looking at your medications with fresh eyes and having an honest conversation with your doctor. Solutions exist. You do not have to suffer in silence.